small gestures of compassion and empathy will make a difference in your life, in the lives of your patients, and the lives of your peers at work. And this one is the important one. Basically, some people reached out to me and just kind of asked me about how do we see, how do we become an indispensable employee or the healthcare worker. And so I'm going to just share this program also uh, with others on Facebook so you can all watch. So whenever we are talking about being indispensable, what does this mean? This means like, you're unique, your abilities are different, and you're hard to replace, and you have your strengths, and people recognize that, and you're happy about it, and so you'll not be easily replaced. You're like kind of like a gem at work, and you are their loyal employee and faithful medical practitioners, etc. And traditionally, how do we build that? Our brand, you can call it these days. We try to gain some experience, go to schooling, and try to gain some experience in a way that you're building up your CV, and you're trying to see how you kind of make yourself more prominent. You gain some experiences. Remember, whenever you build your CV, that makes you feel that how uh, you've accomplished all these experiences, and those things are expected out of you, and people expect that you've been through certain trainings and certain experiences you have, and then they think that you are good at it, and then you will be able to perform those tasks and duties in a much fashion, in a better fashion. Uh, so whenever you start your work, you start your job, a new position, you are at an adjustment phase, and people trying to feel you, people trying to get to know you and try to understand you, and you are new, you're trying to prove yourself, you're trying to learn new techniques. So this phase is very, very important. And I've seen sometime people are thrown in a new work environment, and you don't realize how much impact that have on you if you just don't take care of this time. Because when you start your new work or new job, it's a phase of orientation. You're learning the system, you're learning the protocols, you're learning the environment, you're learning about people, their strengths and weaknesses, all these things happen. So during that time, basically, it's very important that you pay attention to all those important things and don't try to, uh, you know, make friends at this time, because this is the time you want to learn your job description well so you can work better in the future. And a lot of time I've seen that when you're being oriented and a lot of people trying to prove or trying to show off themselves or their abilities at that time. And this is not the time to do that, because then you will not be able to learn, and you just need to stay quiet and gain and listen and all this information from whoever's orienting you and trying to get you back in the system. So this is the time for you to just, you know, keep your mouth shut and pay attention and learn the system. And there'll be other times where your abilities you will come up. That's the time you're going to see soon, but this is not the time. And also sometime people just trying to do a lot of chit chat in the time of orientation. I've seen one nurse that I remember, and that nurse was very, very, very focused. And when she started her work, and she would not let anybody just distract her, or trying to have a small conversation with that person. She said, that's not the time. Time will come, but right now it's important for me to pay attention to my task, pay attention to what I have to do, what's expected out of me, etc. That's a great style, and I think I like that. And I think you should apply this when a new person comes. Just give them the 100% time, attention, so they can focus on what they're expected out of you. And then also there's like a bare minimum thing, it's expected out of you. And you realize that how these things are important, that you you're doing your task, you're doing your work, and something's expected out of you, and you are good at it, what you do. But at the same time, this is just a start. Like, you're probably very good what you do. And so you basically, that's your job description. So that's the starting point for you when you're starting your new position, your new job. And then slowly, now this phase of getting to know people, getting along with people, all these things will start, and get to know the system and about different personalities. And this is the time you're just basically trying to learn about other people. And now you're gonna just basically move forward from being just, from the, to do your, from bare minimum work to do extra. So, because if you just stay at bare minimum, whatever you're doing, that's not enough, and especially in the present world, because you have to develop different techniques, different skills, and just trying to uh, improve yourself. You become an indispensable person, because if you just do a minimum number of tasks, a minimum things you decide to do, and you stay in that zone, whenever there's a bad time of, they have to cut people, they have to let people go, and I think that time they may not consider keeping you, or they may let you go. So this is the time you're preparing yourself, and you're making yourself indispensable in the system, and you're starting to trying to do extra roles. I work in the endoscopy center sometime. There are nurses who does work in the pre-op area, getting patients ready. Some nurses do work in the operating room, and the others work in the, you know, sorry, uh, in the post-op care. And so you have to make sure that you are understanding, and you are good with all these phases, and you learn all these techniques very well. And then basically, now you're developing in this new practice, and in this new group, in this new medical practice, wherever you are. And now you have to see how do you have an opinion, and how you open to change, and you have a growth mindset, and you just basically learning, and you're developing yourself. And as I said earlier in the other videos, that how most of us just, think from the head, but this is also a time for you to develop a good mindset and have a positive mindset, because nobody likes negativity or pessimism, or, you know, you want to make sure that you're positive, and you're contributing, and you stay away from that kind of environment which is toxic and negative environment, because that's going to affect you. And also, now you're bringing out your qualities of the heart, which I mentioned, like how do you bring out, like your compassion, your kindness, your empathy in your practice. And then slowly you're improving and growing in your work, in your new environment. Now you're comfortable, you people know you, you know people, they know your strength, and it's a good harmony, and you're liking your new work and new place. And then the next phase of growth for you is going to be that you become like a role model for others, and you're trying to take other roles of maybe leadership or mentorship, and you mentor other people who come and who are in the similar situation when they start their work. And so now you're showing them the ropes. And so also when you are mentoring, when you're starting or when you're in that phase, don't tell people about others in terms of their abilities and in terms of their lives, and let people make their own opinion and decisions about how they will approach them and how will they see them whenever the right time will come. Because what happens if you tell the new person, the trainees, oh, this person's like this person's like that, and you're already kind of like putting those ideas in their head, and this is how they develop those kind of concepts and getting ideas about those people. So everybody's different. So let others make their own judgment and opinion about other people. Don't try to brainwash them before they start their work. And also, like other factors in your growth to become an indispensable practitioners, and this can be applied not in only in medical practice, but any job where you want to be indispensable. I think these techniques will help. And now you're basically, there are two kinds of people. The first kind is are takers, they just take. And there are other kinds, they are giver, they give. And what do I mean by giving? It means giving your time, and be generous with your time and advice, and just don't take. Sometime you have to give, and that's an indispensable quality when you're a person who's always there and come on time and has ethical behavior. You don't participate in all kind of gossips and nonsense at work. You do your job well, and that's what they said. An indispensable employee or worker is the first one to come and last one to leave. And this is how people will know your work ethics, and they'll be comfortable with you. And slowly, then you're developing, and then you'll have more roles of autonomy. And because in order for you to gain an autonomy about anything, people need to trust you and respect you. And you are at that phase that now they'll be able to, give you tasks so you can just be responsible on your own. You can develop your own team. You could be a project manager. You could be a practice manager, nurse manager. So now you are responsible for your team. And this is how you are building your legacy at your workplace. So imagine where we started, like many people just don't go beyond the bare minimum. They just do the least, and they think that's enough. And then bad things happen when they have to leave, and they start complaining because they have not developed themselves and they have not matured themselves in this new practice or a new office or a surgery center where you are at. And then you basically, these are the steps I think are important, and you have to take, and you're slowly growing and maturing in this healthcare environment, and wherever you are, this is how you'll become an indispensable medical practitioners. And you basically become like the kind of the caretaker of the place, and everybody will come to you. They know that you'll be able to help. They know that you'll be able to assist, and people will trust you, and you're good on your skills. You always maintain and update your clinical skills, medical skills, and also add that the heart portion, the compassionate part. This is how you become an indispensable an employee or a medical practitioner, or wherever you are, or you're a junior doctor, or becoming a part of the practice. This is how you should proceed, and all these things. I hope these things are beneficial for you, and you find some, you take some good points from here, and you can apply. Thank you. So we'll take a short break. If anybody has any questions about this subject, actually we'll have the questions first, and then we'll take a break. And so please feel free to send your question on Zoom, or if you want to send on Facebook or YouTube, please feel free. Question, comments, suggestions, all these things are welcome. Thank you. Did they see you? I was on. Still on.
No questions.
Can you hear me, Dr. Ajmal?
So the next session will start at 11. We'll wait for some of your comments and remarks. If you have any input, please feel free to share and share your experience in terms of how what you've seen when we talk about becoming an indispensable provider or a healthcare practitioner.